Hello, I am Dr. T.S. Roy, ex-professor and head, All India Institute of Medical Science, Department of Anatomy. In this video lecture, I will describe the general features of the brain. The specific learning objectives are: a student should be able to identify the gray and white matter. They should identify the borders, poles, sulci and gyri of the brain. Should be able to identify various lobes of the brain and should know the major functional areas of the brain. This is a horizontal section of the brain where you can appreciate the color difference. The outer part is the gray matter, which contains the neurons, glia and some small fibers. The inner part is the white matter, which contains mainly the myelinated nerve fibers and some fibers of the glial cells. Inside the core of the brain is the ventricle, around which collection of neurons are there. They are called the nucleus. You can appreciate the shape of the nucleus. This is lentiform nucleus. The brain is covered by three layers of membrane: pia, arachnoid and the dura. Dura is the most superficial one. Pia and arachnoid runs together except in the sulci, where the pia enters along with the blood vessels. The elevations are called the gyri. Sulci and gyri are formed due to unequal growth of the brain and the cranial cavity to accommodate the enormous growth of the gray matter. Supromedial border, which separates the medial from the lateral surface of the brain. The fissure or the depression between the two hemispheres is called longitudinal fissure, which is occupied by falx cerebri. The central sulcus is more or less in central position. It runs obliquely on the lateral surface. The central sulcus indents the supromedial border. In front of the central sulcus, this elevated area is the precentral gyrus, and one big sulcus is visible. This is the superior frontal sulcus. The lateral surface. For descriptive purpose, brain has to be divided into different lobes. A line which goes parallel to the central sulcus demarcates the boundary between the frontal lobe and the parietal lobe. The inferior border of the brain starts from the occipital pole to the temporal pole, and there is a notch called pre-occipital notch, which is 5 cm in front of the occipital pole. A line joining the parieto-occipital sulcus and the pre-occipital notch forms the anterior boundary of the occipital lobe. A deep fissure is called lateral fissure. The extension of the lateral fissure is joined with the imaginary line joining the parieto-occipital and the pre-occipital notch, forms the boundary between the temporal lobe and the parietal lobe. The sulci in the superolateral surface of the brain. In the frontal lobe, one can see the precentral sulcus in front of the central sulcus, which runs vertically towards the lateral fissure. In the middle of the frontal lobe, there are two sulci, the superior frontal sulcus and the inferior frontal sulcus. Just below it lies the lateral fissure, which contains the middle cerebral artery. Below the lateral fissure or lateral sulcus is the temporal lobe, and in the temporal lobe there are the superior and the inferior sulcus. In the occipital lobe, there is one arch sulcus, that is the lunate sulcus, just in front of the occipital pole. In the parietal lobe, there is one sulcus called intraparietal sulcus. In the depth of the lateral fissure lies one cortex. This is called insula. The fissure or the gap between the cerebral cortex and the cerebellum is called transverse fissure, where lies the tentorium cerebelli, separating the superior surface of the cerebellum and the inferior surface of the cerebral cortex. The gyri on the lateral surface of the brain are precentral gyrus in front of the central sulcus. It is in between the central and the precentral sulcus. Behind the central sulcus is the postcentral gyrus. In the frontal lobe, there is superior frontal gyrus, middle frontal gyrus and inferior frontal gyrus. The posterior part of the middle frontal gyrus is the frontal eye field area. In the temporal lobe, there are three gyri: superior, middle and the inferior gyri. In the parietal lobe, there is superior parietal lobule and the inferior parietal lobule. In the inferior parietal lobule, on the top of the lateral sulcus, there is an R-shaped gyri, is called the supramarginal gyrus. Just below it, on the top of the superior temporal sulcus, there is another gyrus, that is called the angular gyrus. In the occipital lobe, there are two gyri, superior and inferior occipital gyri. The central sulcus needs special attention. It runs obliquely towards the lateral fissure and it runs parallel to the motor cortex or precentral gyrus, which is in front of the central sulcus. This is very important because the middle meningeal artery, which lies in the dura mater, it gives one branch which is parallel to the motor cortex. Any blood clot or hemorrhage in this part of the artery may interfere with the voluntary movements of the opposite side of the body. The medial surface of the brain, the obvious features are the corpus callosum, the greatest commissural fibers in the brain connecting the two cerebral hemispheres. Just below the corpus callosum, this cavity is the cavity of the lateral ventricle. Below the lateral ventricle is a third ventricular area which is formed by the thalamus and the hypothalamus. The boundary between the diencephalon and the mesencephalon or midbrain is the line joining the mammillary body and the pineal body. Midbrain is formed by this line and a line on the superior surface of the pons and inferior part of the inferior colliculi. The pons is oval in shape or the lower border of the pons up to the fourth ventricle. Below the pons is the medulla and behind the pons and the medulla is the cerebellum. The cavity between the pons, medulla and the cerebellum is the fourth ventricle. The medulla continues as spinal cord. The medial border of the brain is formed by the line joining the occipital pole and the frontal pole. In the middle, it is interrupted by the midbrain. The sulci and gyri on the medial surface of the brain are cingulate sulcus and the cingulate gyrus, which lies just above the corpus callosum. The medial frontal gyrus. On the lateral surface, we have seen superior, middle and inferior frontal gyrus. On the medial surface, this is the medial frontal gyrus. And behind the termination of the cingulate sulcus, this area is paracentral lobule, which is indented by the central sulcus. Anterior to it is the motor area or the motor cortex and posterior to it is the sensory cortex, which are the extension of the same cortex from the lateral surface. The parieto-occipital sulcus is an extension of the calcarine sulcus, which starts below the sphenium of the corpus callosum. It is a Y-shaped sulcus. The anterior limb of the Y forms the parieto-occipital sulcus and the posterior limb is called the calcarine sulcus. In the calcarine sulcus lies the primary visual area. Limbic lobe of the brain is better visible on the medial surface. It has certain gray matter and white matter. The gray matter are certain gyri and nucleus. The gyri are hippocampus, parahippocampal gyrus, the entorhinal cortex which lies lateral to it, the cingulate gyrus. The nuclei are part of the thalamus, hypothalamus, amygdala which is not visible here, and the fibers are fornix and strata terminalis. The sulci on the inferior surface. The visible borders are superciliary border and the lateral border which extends from the occipital pole up to the temporal pole. Superciliary border or the lateral border of the orbital surface is from the orbital pole to the lateral sulcus. The sulcus in the orbital surface are olfactory sulcus, which is occupied by the olfactory bulb and the olfactory tract. The sulci visible in the inferior surface of the temporal lobe and the occipital lobe are collateral sulcus, occipitotemporal sulcus. The gyri on the inferior surface are orbital gyri on the orbital surface and the gyrus recti on the medial side of the olfactory sulcus. On the inferior surface, the gyri are parahippocampal gyrus, medial to it is the uncus, lateral to it are the lateral and medial occipitotemporal gyri. Brodmann's area. According to cytoarchitecture of the brain, Brodmann classified the areas into 52 and named accordingly 1 to 52. Here you can see the different numbers. The primary motor area is area 4, responsible for execution of motor movements. The premotor area or area 6 is area for planning for any movement. So, this acts as a computer software and execution part is done by the hardware, like the motor cortex is the hardware and premotor cortex is the software for planning of the movements. The posterior part of the middle frontal gyrus, that is area 8 and 9, is the frontal eye field area, area for conjugate deviation of the eyeball. This is showing the conjugate deviation, both the eyes are moving in the same direction. The Broca's area is situated in the lower part of the motor cortex. It is area 44 and 45. This is the area for vocalization, and in the right-handed person it is situated in the left hemisphere. In the temporal lobe, in the superior temporal gyrus is the primary auditory area or area 41 and 42. Area 41 is inside the floor of the lateral sulcus and area 42 is on the posterior part of the superior temporal gyrus. The primary visual area is situated mainly on the medial surface, but part of it extends in the occipital pole. The gyrus in the parietal lobe is the primary somatosensory area, area 3 to 1. This is for appreciation of the general sensation, pain, touch, temperature, muscle sensation or proprioception and vibration. On the medial surface, there is extension of the primary motor area or area 4 and supplementary motor area. The primary visual area is situated in the floor and banks of the calcarine sulcus, part of which extends on the lateral surface. This area 4, 3 to 1, this is called the paracentral lobule. Here the lower limbs and the perineum is represented. So, area 4 controls the lower limb of the opposite side and area 312 receives the general sensation and the pain, touch, temperature sensation from the opposite leg. So, in short, according to the cytoarchitecture, Brodmann has classified the different areas of the cerebral cortex. Area 312 situated Behind the central sulcus is the primary somatic sensory cortex, which is responsible for appreciation of the general sensation, pain, touch, temperature, vibration sensation and the muscle sensation. Area 4, that is the primary motor cortex, situated in front of the central sulcus, responsible for the movements of the opposite side of the body. Area 6, situated in front of the primary motor cortex, it is called premotor and supplementary motor area. This is for planning of motor actions. Area 8 and 9 lies in the posterior part of the middle frontal gyrus. It is called frontal eye field area. It is for conjugate deviation of the eyeball. Area 17, situated in the occipital lobe, the banks and floor of the calcarine sulcus. It is primary visual area. Area 41 and 42 is in the temporal lobe, in the superior temporal gyrus and in the floor of the lateral fissure, that is the primary auditory area. Area 44 and 45 is the Broca's speech area or the center for the vocalization. In right-handed person, it is present in the left hemisphere. So, to summarize, the frontal lobe is located in front of the central sulcus. The sulci present are precentral, superior and inferior frontal sulcus. The gyri are precentral, superior, middle and the inferior frontal gyri. The frontal eye field area and the motor speech area are located in the frontal lobe. The parietal lobe is situated behind the central sulcus. The sulci are postcentral sulcus and the interparietal sulcus. The gyri are postcentral, which is responsible for the appreciation of the general sensation of the body, superior and inferior parietal lobule. These are the association areas for integration of all other sensations. The occipital lobe is situated behind the line joining the parieto-occipital and the preoccipital notch. The sulci are calcarine sulcus, which is present on the medial surface, slightly also in the occipital pole, and the lunate sulcus in front of the occipital pole. The gyri are superior and inferior occipital gyri, and the occipital lobe is responsible for vision. The temporal lobe is situated below the lateral sulcus and the line joining the lateral sulcus and the imaginary line joining the parieto-occipital sulcus and the preoccipital notch. The sulci present are the superior and the inferior temporal sulcus. The gyri are superior, middle and the inferior temporal gyrus. Here lies the primary auditory area. The sulci and gyri in the inferior surface of the brain are in the orbital part. There is orbital gyrus and there is one straight gyrus called gyrus recti. In the inferior surface of the temporal lobe, the sulci are the collateral sulcus and the occipitotemporal sulcus. The gyri are parahippocampal gyrus, the medial and lateral occipitotemporal gyrus. The function is mainly olfaction and related to complex behavior. So, take home message is that human brain has extensive gray and white matter which is folded to form the gyri and sulci. The central sulcus, lateral fissure and the parieto-occipital sulci are the landmarks for description of various lobes of the brain. The central sulcus divides the motor and sensory cortex. Visual area is around the calcarine sulcus. The auditory area is in the floor of the lateral fissure and on the superior surface of the superior temporal gyrus. The motor speech area is situated in the lower part of the precentral gyrus in right-handed person. The limbic lobe is visible on the medial and inferior surface of the brain. You should read details about the sulci and gyri from Bart's Nervous System, Cunningham's Manual of Practical Anatomy, and the textbook of Neuroanatomy by Batistas and Gardner. Thank you.